And in this week, these were the topics that were covered: immune and blood response to materials, where basically the basics of the immune system was discussed, and complement system, and blood clotting and hemocompatibility of materials. All of this with respect to biomaterials as well as adaptive immune response and vaccines. We have few questions from the previous assignment based on these topics. Here is the first question. Which of the following options represent the correct chronology of events in inflammation? I'll give you some time to answer and then we'll discuss the answer. Anybody else would like to answer? Yes, the first option is correct. Vasodilation, then edema, then influx of leukocytes, followed by clearing and healing is the correct uh, representation of the chronology of events during inflammation. Wherein vasodilation, basically the blood vessels dilate and increase in diameter. uh, the capillary's diameter increases, leading to reduction in velocity of the blood flow, as well as there is increased permeability of these capillaries that leads to influx of various protein rich fluids and cells, which forms the edema. And then because of the reduction in the velocity of the blood flow, there is influx of leukocytes and phagocytes which then seep through this um, extravasate through these blood vessels into the affected tissue, and then that is followed by healing and tissue regeneration, that is formation of new capillaries and scar tissue. Okay, we have the next question here. The three arms of the complement cascade converge at a protein complex known as. Okay, C3 convertase is the correct answer. So basically, there are three different pathways that get activated: the classical pathway, the alternative pathway, and the lectin mediated pathway. Though they start at different points, they all converge at the C3 convertase. Okay, we have the next question here. Which of the following approach can be employed to reduce complement activation on a biomaterial surface? You have to select two correct options here. Yes, you are correct. Option 2, reduce surface nucleophiles, and option 5, heparin adsorption to the surface. This binding of C5p protein to the complement cascade looks similar, but it's binding of C5a. So these are the three main pathways to minimize the complement activation. First, the reduction of the surface nucleophiles, that basically reduces binding of C3b to the surface, and then binding of C5a reduces patient exposure by reducing the patient. So C5a is the primary cause of inflammation, and if you can bind C5a to something else or ablate it separately, it will reduce the further inflammation and other activation of other pathways. And then heparin adsorption, it acts through factor H to inactivate C3 convertase, where basically all the other pathways converge to initiate a response. So using these three pathways, you can minimize complement activation by materials. We have the fourth question here. Which of the following factors can cleave fibrin in vivo?
Plasmin.
Okay.
Plasmin.
Okay. Anybody else would like to answer? Yes, plasmin is the correct answer. Out of all these options, only plasmin can cleave fibrin in vivo. Okay, we have fifth question here. Pick a incorrect statement regarding cytokines. You have to select two options that are incorrect here.
First option and the last option.
Okay. Anybody else would like to answer? There are two incorrect options regarding cytokines here. Yes, first and last options are correct. So, cytokines are small lipid molecules that are released by various cells in the body, usually in response to an activating stimulus, is wrong. Instead, cytokines are small proteins that are released by various cells in the body in response to activating stimulus. And cytokines in their active forms are always pure peptide, not necessary. They could be uh, attached sugar or lipid moieties to these cytokines. And rest of the options are correct as mentioned here. They act in autocrine manner or paracrine manner. And we have our next question here. Inflammation facilitates the onset of extravasation. What are two correct options here regarding this inflammation?
Last two options.
Okay. Anybody else would like to answer? Yes, last two options are correct. During the
Option 3
process,
also correct.
sorry,
Option 3 and the
upregulation of
last option.
adhesion molecules on endothelial cells, followed by release of chemotactic factors. There is upregulation of receptors, right? Yes,
Foods.
yes, I think option three should also be correct. First of all, there is velocity decrease in velocity, and it allows for interaction with the endothelium. Before this process, there is upregulation of this adhesion molecules that helps in interaction of these cells to the endothelium, and then the rolling adhesion initiated via these interactions between the carbohydrate moieties and the selectins. And after this interaction, they extravasate into the affected area. Okay, here is the next question. What is the role of platelets during blood clotting?
Option 1 and option 3.
One and three. Okay.
Option 1 and 3.
Okay. Yes, option one and three would be the correct answer. So it stimulates, it react, basically platelets react with the ECM proteins when blood vessels are severed or there is interaction with the biomaterial surfaces. and they release variety of chemical mediators from granules which stimulates the coagulation and wound healing process. So basically the stimulation of the clotting of blood and release a variety of chemical mediators to promote that promotes clotting and healing of damaged tissue. Okay, here is the next question. Which of the following systems is directly involved in the initial response to biomaterials when they come into contact with blood? Which of the following systems is directly involved in the initial response to biomaterials when they come into contact with blood? Which of the following systems is directly involved in the initial response to biomaterials when they come into contact with blood? Anyone? Okay, the correct answer here would be complement system. Just now in the previous questions, we discussed how the complement system, there is cascade, gets activated. So in terms of biomaterials, this complement system is directly involved for the initial response. Adaptive immune system is also there, but it will come later. First of all, there is innate immune system basically in this complement system. Okay. We have the next question here. Which of the following is not a function of inflammation? Anyone? Anybody would like to answer? Which of the following is not a function of inflammation?
Option 2.
Okay. Anybody else? Yes, option 2 would be the correct answer. Here it is asking which of these is not a function of inflammation. So, as in the previous questions, we saw there is vasodilation, and then there is recruitment of leukocytes to the site of injury, and then at the end, there is repair processes initiated, and then healing and scar tissue forms. But there is no concentration of toxins. Rather, during this inflammation process, it gives more permeability to it becomes more permeable, and there is uh, it becomes more permeable, and there is the because of the edema formation, there is lot of fluid gets uh, also transferred to the site of inflammation. So because of blood and these kind of fluids, the concentration will get diluted rather than concentrated. Okay, here is one more question. Which of the following best describes the role of foreign body giant cells in a foreign body reaction? Anybody would like to answer? Which of the following best describes the role of foreign body giant cells in a foreign body reaction? Okay, the correct answer would be option B. They result from the fusion of macrophages and are involved in long term reactions around implants. Since these macrophages are really small, so when there is an implant around it, they can't engulf the entire implant, so they start fusing and it forms a giant foreign body giant cell. Okay, we have another question. Which pathway? Okay, which of the following? Sorry, which pathway of the complement system is the most relevant for biomaterial interactions?
Alternative pathway.
Okay. Anybody else would like to answer? Yes, anybody else would like to answer? Which pathway of the complement system is the most relevant for biomaterial interactions? Yes, the correct answer would be the alternative pathway. In the complement system, there are basically three pathways: the classical, the lectin mediated, and the alternative pathway. And this alternative pathway is the most relevant for biomaterial interactions. Okay, we have another question here. What is the main concern with fibrous capsule formation around drug delivery implants?
Last option.
It creates a diffusion barrier. Okay. Anybody else would like to answer?
Thank you, ma'am.
Welcome. Which of the following options represent the correct chronology of events in inflammation? And the answer would be for option 1, vasodilation, which is followed by edema and then influx of leukocytes, clearance, and then healing. Second question was the three arms of the complement cascade converge at a protein complex known as. Correct answer would be option 2, C3 convertase. Third question is which of the following approach can be employed to reduce complement activation? And the answer would be to reduce surface nucleophiles and heparin adsorption to the surface. Next question was which of the following factors can cleave fibrin in vivo? Answer would be plasmin. Next, pick the incorrect statements regarding cytokines. Correct options here would be option 1. Cytokines are small lipid molecules that release various cells in the body, usually in response to activating stimulus. And the last options in cytokines in their active forms are always pure peptide chains without sugar and lipid moieties. Instead, cytokines are small proteins that are released, and they they are not always pure peptide. They come with sugar and lipid moieties attached to them as well. Next question. Inflammation facilitates the onset of extravasation. You have to select correct options here. So the last two options, during the process, the velocity of blood flow decreases and allows for cells to interact with endothelium, and it involves the process of migration of neutrophils through the endothelial layer. Along with this, the third option, it is the upregulation of adhesion molecules on endothelial cells, followed by release of chemotactic factors. These three options would be the correct answer. Here's the next question. What is the role of platelets during blood clotting? The correct answer would be to stimulate clotting of blood and wound healing and release variety of chemical mediators that promote clotting and healing of damaged tissues. Next question was, which of the following is directly involved in initial response to biomaterials? The answer would be complement system. Which of the following is not a function of inflammation? Answer would be concentration of toxins. Instead, it would be dilution of the toxins. Which of the following best describes the role of foreign body giant cells in a foreign body reaction? So here option B is the correct answer. They result from fusion of macrophages and are involved in long-term reactions around implants. Next question was, which pathway of the complement system is most relevant for biomaterial interactions? Here the correct answer would be alternative pathway. What is the main concern with fibrous capsule formation around drug delivery implants? Here the correct answer would be it creates a diffusion barrier, limiting drug release and therapeutic efficacy. So these were all the questions that we discussed